We actually have something that can make that skin and fat around the knees look better. And I have to tell you, before we got this technology in, I was turning people away right and left, telling them there's nothing I can do. So our patient today has 3 issues. She has stretch marks on her knees, she has skin laxity and crepiness around her knees, and she also has fat around her knees. So we are going to be treating all 3 of these things today using BodyTite and Morpheus8. First, we're going to start out by numbing the area that we are going to treat with some injections. She's completely awake, so this is very tolerable. After she's been numbed up, I am going to place a couple poke holes to place the BodyTite underneath her skin. Kind of sounds like bacon cooking. We're going to be delivering that radiofrequency heat to the fat and the skin, getting it up to the proper temperature to cause skin tightening, as well as melting some fat and tightening the ligaments under the skin. You can almost think of it like the skin is being saran wrapped back around the knee. After we've treated and delivered the radiofrequency from the BodyTite probe, I will actually go in with a liposuction cannula and suck out some of the fat from the medial knee. A lot of people have fat on the middle aspect of their knee, and that sort of makes their legs look a little bit shorter than they actually are, because as the eye is going up the leg, it kind of stops at that bulge at the middle knee. So when you remove that bulge, it makes the legs look so much leaner and longer. It's a great visual effect to give somebody immediate gratification after this procedure. The BodyTite only needs to be performed maybe once every 3 to 5 years. With the Morpheus8, we do recommend like 3 to 4 treatments spaced 1 month apart, about every year or 2, just to keep boosting that collagen up. And especially with stretch marks, multiple treatments are recommended. After the BodyTite and the liposuction is performed, I'm actually gonna bring out the Morpheus8 device, which is radiofrequency with microneedling. So I'm not only giving radiofrequency from under the skin, I'm actually gonna come from above the skin to give radiofrequency through microneedling as well. And this combination of BodyTite and Morpheus8 is commonly referred to as embraced RF, because we're embracing the skin from underneath and on top. The Morpheus8 is going to bring collagen back into the skin, it's going to give further tightening, and it's a great treatment for stretch marks. People get immediate gratification from the liposuction, from removing the fat, but the skin tightening actually continues to improve month after month, up to about a year. Usually around 3 months is when people are like, okay, I'm starting to see some of the skin tightening. It's better at 6 months, better at 10 months, and after a year, kind of what you see is what you get. After the procedure, usually patients just go home, keep the area wrapped for about a couple weeks, whether it's with an actual ACE wrap or with something like Spanx to give it a little bit of compression and support. There really isn't a lot of pain after this procedure. It is a little bit sore, kind of like you worked out at the gym, but nothing too crazy. So if you are hating your knees and you think there's nothing out there, there is something out there. We have BodyTite and Morpheus8, and I definitely recommend you come in to discuss your options.